MS is interesting, right? I do one of two things, and I do this with a lot of kind of what I would consider big, complicated disease states. So you have some choices. One would be working with somebody on symptoms. So probably stuff that would be more obvious to you, like you have somebody who usually people with MS, especially in the later stages, but they sort of have these bouts of MS where they're better, and then sometimes they decline during the bouts, and then they rehab themselves back. So some things that happen in there are balance and the ability to sometimes use certain muscle groups. So in that way, I take like a developmental approach physically, and work on balance and work on muscle groups that aren't innervating as well. So that's the more obvious physical part, and that is incredibly helpful to people with MS. A lot of times they have PT that's really good and rehab stuff, but the sort of self-physical education is missing. So, sort of connecting the dots physically is important. And then you can also look at it from a sort of autoimmune koshic perspective, and sort of think of it as a disease state in that way, and start to investigate on what levels you can actually work with the person. So one thing that is often the case in sort of an energetic way is that you're not just dealing with the physical body, but you have a lot of chronic body issues. And I think with MS in particular, you can correlate sort of nerve and myelination of nerves to a lot of the ways yoga has always talked about the pranic body. So often I will do a bunch of work in the pranic body, and that of course includes pranayama, and it also includes pranayamas with visualizations that involve different parts of their body. The main idea, again, is to sort of reconnect to their brain, to that part of the body. And that's been really helpful for a lot of my clients. There's a sort of bigger question on like a doshic way on what's going on. Often you have sort of extreme vata imbalances. So sometimes I'll look at it that way. And in the course, we talk about, how to kind of work with vata within each kosha. We work with some vata balancing asana, and then some vata balancing pranayamas, which are generally left-right stuff here early. Yeah, so you'll see how we work through this, but we take the doshic concept, like the vata, pitta, kapha, and we look at it within each kosha, right? Physical, energetic, conscious, unconscious, and bliss. So, as we get down towards, there's pranayama for the pranic body, and then there's some vata balancing asana, which is mostly moving and breathing, and the vata balancing in the pranayama world is stuff like alternate nostril breathing and ujjayi, as opposed to like Kapalabhati, which is heating. So we do vata balancing there, but then we also start to look at what types of balance will work in the conscious and unconscious or wisdom body. So we start working on, for the wisdom body, we start working on meditation techniques that would be more appropriate for vatas. And sometimes you can combine these things. So I'll usually take an approach like that. So I'm trying to get to how this would end up. So what you end up having is someone doing some sort of asana, some sort of pranayama that leads into usually an embodied vata balancing practice, like breathing up and down your spine and meditating on it, and then letting the breath go. So that all gets connected. You could think of it that way for the pranic body, but it's also a vata balancing practice, right, for the wisdom body. And the general theory there is that the whatever sort of possibly, and this is not always the case, so don't take this too literally because it's not always true, but um, there's a possibility that in the wisdom body, in the unconscious mind, right, there are things that are contributing to the condition. So you're looking for meditation practices that will bring them to light and move them out of the wisdom body. And so sometimes people can receive some deep healing from that body. So that's why it's important to put those in. So it kind of brings up like what's different about yoga therapy. I mean, you could also say, hey, look, meditation reduces stress. Stress is bad for MS symptoms. So any version of meditation is going to improve the outcomes for someone with MS. So that's one way to look at it. But in yoga therapy, I think it's better to try to be a little more specific and sort of look at it in these bodies. So, we have specific practices to balance specific doshas, right? So now we're saying, well, not just any meditation, but this meditation. And what we're looking for is signs that that person doing that meditation is actually helping them. And in MS, it's, the signs tend to be kind of clear, actually, because people say, well, I haven't had as many symptoms, or I stayed asymptomatic if they're early and they're getting treated with pharma, because there's some good drugs now that really slow the progression of MS. And, the spaces between big bouts with it are getting longer. So that's how I look at it. So it really depends on how this person is kind of signed up to work with you. So a lot of times, someone comes in, they say, I heard yoga is good for MS. Tell me about it. Maybe you give them the lay of the land like I just did, but maybe in a simpler way. And they say, wow, that's a lot wackier than I thought. I just really wanted to work on my balance and keeping my, partially myelinated. Just for you guys who don't know, MS is a disease that affects it's basically the connection between your brain and your muscles a lot of the time. So there's myelination on the nerves that innervate your muscles. And it's an autoimmune disease where that myelination gets basically destroyed. So the signals, don't run as clearly. And there's more to MS than that, but that's the basic idea. So, often, as you can imagine, it'd be a really good idea if some of your nerves that are myelinated are kind of Swiss cheese, right? That you would want to make sure that the rest of them are really firing properly. So the more you use them, the better. And then in the brain, there's also demyelination occurring. So the brain is very plastic. And so by kind of moving it around limbs around a lot, you're retraining the brain. Maybe the brain has to create a new pathway to make that happen. So the physical asana stuff is really good. Anyway, back to what I was saying. So maybe the person says, that's all nice, the wisdom body and all, but really I just came so you could do some yoga with me. So in that case, you're looking at like really basic asana sets and really working in a complete way, but with areas that sort of maybe have become less myelinated, and so you can sort of maintain that functioning for them. And then the other big thing with MS is balance and right brain, left brain communication. So I'm always doing in the asana part, like there's a lot of moving and breathing left and right, things moving left and right, one leg at a time, one arm at a time, opposite legs and arms, twisting one way, moving your lower half in the other way, stuff like that.